Welcome back. You're still watching The Globe. The World Health Organization says that the current rise in COVID-19 cases in Africa is extremely worrying as more countries are recording increases in cases. The WHO says that the spread of new variants of the coronavirus, including the Delta variant, is partly behind the surge. The WHO says that the number of cases and deaths in Africa has increased almost 40% in the past week. And in some countries, the number of deaths has tripled or quadrupled even. Cases are on the upward trend in at least 12 countries, with South Africa, Uganda, the Democratic Republic of Congo, Namibia, Zambia, Rwanda, and Tunisia among the countries worst affected. The continent also lags behind with vaccinations, accounting for just under 1.5% of all the vaccines administered globally so far. The WHO says that the arrival of cooler winter weather in southern Africa has increased the risk of infection. Across the continent, cases are rising at a faster rate compared to other waves and are expected to surpass the peak of the second wave recorded in January 2021. For more on this concerning situation, this rising coronavirus figures in Africa, we're now joined via Skype by Dr. Mary Stephen, who's a technical officer for the World Health Organization Regional Office in Africa, in Congo, Brazzaville. Dr. Stephen, thanks very much indeed for joining us. This third wave, has it taken us by surprise, the numbers that we're seeing?
Yes, thank you for having me. The situation in Africa it's really concerning, especially the situation with this third wave. We are seeing a rapid increase in number of cases. We have seen a steady increase in number of cases for the past 5 weeks, and this is increasing faster than what we have seen in the first wave and the second wave. And the rate at which the cases are spreading, hospitals are getting full, and the number of deaths being recorded on the continent is also very worrying.
Are there any regions in particular that are affected? The southern part of the continent is in colder weather. Is that where most of the action is, or it's in other parts of the continent as well?
So the southern part is one part of the region where we are seeing increase in number of cases, but we are also seeing increase in number of cases in countries like Uganda, for instance, Democratic Republic of Congo. So this is as a result of a combination of factors, really. The southern part, they are in their winter, people are indoor, and of course, continued interaction without observing the physical distancing, not wearing masks. Then we have the other parts of the region where relaxation of movement restriction has happened to reopen the economy. And then because of the fatigue, people no longer pay attention to wearing their face masks, keeping their distance away, keeping hand hygiene, and avoiding mass gatherings. So a combination of these factors, including the Delta variant that is highly transmissible, as well as low vaccine coverage, contributes to this increase in number of cases that we are seeing.
All right. So the resources available to countries on the continent, the number of facilities, and also just staff, a challenge, I guess, at this time.
Yes, it is challenging. When we did an assessment just before the third wave started on the continent, when we started seeing cases in India, we recorded the averagely about 1 per 100,000 ICU bed was what we have, compared to what you find in the United States or Germany, about 25 per 100,000. The limited capacity of oxygen as well as human resource capacity were all recorded. And this is it's becoming very, very obvious as cases are increasing rapidly and expanding beyond the capacity of the health system to deal with. So we are seeing critical care capacity being overwhelmed, oxygen, people are looking for oxygen everywhere. Sierra Leone, Liberia, Uganda, DRC, so Namibia, all these countries, including the ICU beds, the human resource capacity. People are tired, health workers, they need, because of the cases that are increasing, they are overwhelmed, and they need a lot of backup in terms of human resource capacity to cope with the rapid increase in number of cases.
Given what's happened in other parts of the world, could we have been better prepared for this third wave?
So for this third wave, one of the things we could have done on the continent is to make sure that we didn't lax in terms of the preventive measures, because these are simple measures but very, very important in reducing the exposure and transmission, given the low vaccination coverage that we have on the continent. So making sure that people are observing the preventive measures that we earlier talked about, as well as rapidly expanding these capacities for critical care, the oxygen, the ICU beds, the human resource capacity in anticipation of the third wave could have helped a lot, but the rate at which the virus is spreading as well, people didn't expect that it would spread this fast, given the experience we have had in the first and the second wave.
Are we seeing better testing levels, or are we just relying on people showing up at hospital to get a sense of just how big the problem is?
Okay, with regards to testing, we have a number of countries that are meeting the targets of 10 tests per 10,000, but majority of countries are still not meeting that target. As a result, of course, the number of cases that are out there, especially the asymptomatic, could be missed. But like you said, yes, we can have an idea, especially in countries where the testing is not adequate, by looking at what is happening in terms of the capacity of the health system, whether these beds are full, more patients coming, and community deaths. So we can have that idea. But definitely, countries need to ramp up testing as well.
Is there a way that vaccination could be speeded up? Because I guess this probably is one of the big pillars that we have to try and stem the tide.
Yes, the vaccine equity is still a challenge, especially for us in Africa. Out of these 2.9 billion doses that have been administered, we have administered about 47.5 million. So far, we have received only 64 million doses, both from COVAX and bilateral arrangements. So you can see that the continent is really, really lagging behind in terms of the vaccination. But part of it is the access to the vaccine itself, where we saw a drawback in terms of the production when India started having their third wave. But we continue to advocate for more equitable access to this vaccine, because if you have a lot of susceptible population, then the virus will continue to spread across the continent. Hospitals will get few, they will get overwhelmed, and of course we will continue to see increase in number of cases and deaths.
South Africa has ratcheted up its alert level, but to a hybrid level 4, which means a bit of economic activity continues. I wonder, though, in other parts of the continent, should their alert levels be raised even more than they are at the moment?
Yes, the WHO recommends countries to use risk-based approach to implementing the physical and social measures. So it will depend on their context, but if you find yourself in a situation where the cases are expanding rapidly, there was a week where we saw over 100, some countries over 200% increase in number of cases. So if you find yourself in such a country, it's inevitable that this movement restriction has to be implemented to complement the effort by government to care for the critically ill in the hospitals. So yes, the implementation of these measures is helpful in slowing down the progression of the virus spreading across different countries, while government continue to ramp up the capacity for clinical care. So it's very important.
What other differences are you seeing with this wave, with these new variants in the picture? Are we seeing more and more cases that are becoming severe than before?
So with this variant, what we have seen is that the transmissibility is higher than all other variants that we have seen before. And as a result, there is rapid increase in number of cases, and because of this we are seeing rapid increase in number of hospitalizations. Of course, the increase in number of deaths as well. And it is thought that this Delta variant also is associated with prolonged high viral load in the system. So a combination of this with our hospitals being overwhelmed, and when you have the hospitals overwhelmed, of course, the quality of care is likely to reduce. So all these factors put together, the health-seeking behavior, how early did you appear in the hospitals, will contribute to the mortality we are seeing.
Are we seeing younger people across the continent testing positive with symptoms than before?
Yes, with regards to this Delta variant, especially in countries like Uganda, that started seeing rapid increase in number of cases where the Delta variant has taken over. It's reported in about 97% of their new cases, increase in number of cases among younger people, and also increase in severe cases in people younger than the age of 45 has been documented in countries like Uganda. But of course, the data, we continue to collect more data with regards to the severity of cases on the continent.
When do you think we need to have a more regional approach? In other words, government sitting together and saying, like we've done in South Africa, people can't go in and out of the major province, Gauteng, which is the epicenter at the moment of the virus. What about countries that have got borders? And should we be shutting those borders and just allowing maybe trade to go through?
So like I said earlier, risk-based approach again. We need to look at what is happening in a given country, the transmission, the capacity for response, and implement those measures that we think will limit the spread of the disease. If you remember from the beginning of the outbreak, the movement restriction and closure of the borders was what happened to limit the number of cases. But of course, we found ourselves with a lot of economic consequences with regards to that. So as much as possible, sub-regional collaboration, region-wide collaboration is also very, very important. Even if people are moving across the borders, we need to make sure that they are moving safely. And when we find ourselves in a situation where our hospitals are completely overwhelmed, then we will have no option but to look at how to limit that movement to essential movements.
Dr. Mary Stephen, thank you very, very much indeed for that update and keeping us informed about the situation on our continent. Thank you for your time. Good talking to you.